What does being diagnosed with bladder cancer mean?
Well, when a patient has been told that they have bladder cancer, they really at first are quite shocked by that and are concerned what this means to them in the long run. Usually bladder cancer is a superficial disease that means it can be treated by a local treatment, usually with a scope, not involving a major surgery, but rather a brief outpatient procedure that can oftentimes lead to the diagnosis, and a lot of times that may be the only treatment that's necessary as well.
How is bladder cancer treated?
Bladder cancer is usually treated at first with some type of outpatient procedure where a scope is put in the bladder and the tumor is essentially scraped out, much like a colon polyp is done with a colonoscopy by a colorectal surgeon or a gastroenterologist. And then following that procedure, the pathology is reviewed with the patient, and depending if there's no invasion at all, then that's all the treatment they need, and then they just need close follow-up. If there's evidence of invasion into like the first layer of the bladder wall, which is called the lamina propria, then they might need what's called an intravesical treatment, which is some form of medicine that's put in the bladder on a weekly basis, usually for about 6 weeks. If the bladder tumor is muscle invasive, which is a relative rarity, that's probably less than 30% of the time, at least on the first tumor someone has, that's a lot more serious of a condition and can require even removal of the bladder or some form of combination of radiation therapy or chemotherapy.
Can bladder cancer be cured, or will my bladder be removed?
The good news about most patients with bladder cancer is that most of them are either cured or very well controlled for the rest of their life. The risk of dying of bladder cancer, if you've been given that diagnosis, is a lot less than like if you were given a diagnosis of lung cancer or pancreatic cancer. Invasive bladder cancer, if it invades into the wall of the bladder, so-called muscle invasive disease, does carry a significant risk of death from it if not treated aggressively and appropriately. But the vast majority of people who have bladder cancer have a superficial type that can be recurrent. The risk of recurrence of bladder cancer in the first year is about 15%, and it's about 30% by the time you finish your second year of follow-up. But usually can be treated, and treated by repeat resection, and again there are medicines that can be given that may decrease the risk of recurrence. And as far as does someone need to lose their bladder in the whole process, it does happen. We do have people that have to have what's called a radical cystectomy, but again that's a lesser subgroup. Those are people that either have muscle invasive disease or have super bad recurrent cancer that need it treated that way.
What increases my risk for bladder cancer?
Risk factors for bladder cancer have been studied for many years. It's actually one of the most interesting cancers from that standpoint because when we ingest things or are exposed to environmental toxins, your body tends to take them and excrete them, and then in the process your bladder stores them. And so probably the biggest risk factor of them all for bladder cancer is smoking. Basically it increases the risk for bladder cancer many fold and puts people at great risk for bladder cancer. Are there non-smokers who develop it? Yes. What other factors can put someone at risk for bladder cancer? One of them is previous radiation therapy. We certainly see men who've had prostate cancer and were treated with radiation therapy. It does increase the risk of bladder cancer in the long run. There are women who are treated for different kind of gynecologic malignancies by radiation therapy that are increased risk. Another one that we see not uncommonly is women that are treated with Cytoxan, which is a form of chemotherapy for breast cancer. There's something in that tends to increase the risk for bladder cancer as well. And then there are some kind of other risk factors. For instance, males are higher risk than females. Is that because more males smoke? I think there's still probably some increased risk for males beyond that. And then also the white or Caucasian race is at higher risk as well.